Happy Wednesday, everyone. From the Ovarian Cancer series, today I want to talk about different types, diagnoses, and conventional treatment. There are some risk assessment tools for ovarian cancer. I will share with you one of this risk assessment tool in a caption that you can find out more about that. Usually in this type of risk assessment, they ask you several questions about your height and weight, if there is any history of hormone replacement therapy, if there is any history of breast cancer for yourself, any ovarian or breast cancer in family, if there is any gene mutation for yourself or family. And based on your response to this question, they give you some estimate of how you're exposed in terms of risk for ovarian cancer. So this risk assessment gives you some good idea in terms of what are major risk factors and what really in terms of prevention you can focus on. Let's talk about different types of ovarian cancer. So we have three major types. Epithelial ovarian cancer, which is the most common type. Germ cell ovarian cancer, 5 to 10% of cancers are this type, and it usually happens in very younger ages, like in 20s and 30s. And the third type is the sex cord stromal cell ovarian cancer. There is a specific features with this type, that this type usually produce hormones. So patients that they have this type of cancer see some kind of hormonal related symptoms, for example, abnormal hair growth, or for example, menstrual bleeding after their menopause. So this might be related to this type of ovarian cancer. In terms of the diagnosis of ovarian cancer, usually your family doctor do kind of investigation in terms of a pelvic exam that they do for you, in terms of trying to palpate the organs in the pelvic area, if there is any mass, if there is any tenderness, anything that might direct them toward doing more investigation in terms of doing ultrasound, doing a CT scan. There are also some blood markers that can be measured in your blood. The major marker for ovarian cancer is called CA-125. Sometimes your specialists end up even doing surgery to get ovary out of the body, to do kind of sampling and biopsy and find out about the cancer. There's always almost some options also for genetic testing to find out more about ovarian cancer in the family. In terms of the conventional treatment for ovarian cancer, the first and most important thing is surgery. Surgery might be just removing ovaries alongside with the fallopian tube. Sometimes also surgeon needed to remove uterus, cervix, alongside with all the lymph nodes in the pelvic area. There are also different types of chemotherapy. We have a neoadjuvant chemotherapy, which is usually done before surgery in order to shrink tumor and get it ready for surgery. We also have adjuvant chemotherapy, which is usually done after surgery in order to prevent the risk of recurrence of the tumor. Sometimes after debulking surgery, which is done for ovarian cancer, there is still tiny tumors in the pelvic area, and oncologists would like to do intraperitoneal chemotherapy to manage that kind of small tiny cancers remaining after surgery. In next video, we will talk about naturopathic approach and what exactly can be done from the perspective of natural medicine besides chemotherapy and surgery to help patients with ovarian cancer.